Welcome to the deep dive. We get you well informed, fast. Today, we're tackling something really critical, but maybe overlooked. It's about research in palliative and end-of-life care.
That's right. High quality care, especially then, is so important.
Absolutely. So our mission today is to, well, unpack what's really holding back the crucial research we need in this field. It touches all of us eventually.
And palliative care really should be built on solid evidence. But, there's this recent study, Walshe and colleagues from 2024,
Okay.
and it shows these persistent, almost stagnant barriers stopping research getting done. And what's really interesting is it's often not about patients being unwilling. That's a common idea, but maybe not the core issue.
Ah, okay, that's a really important point right there. So what did the study find that was maybe surprising?
Well, it's this really stark paradox. Get this. 73% of palliative care professionals want to be more involved in research. 73%.
Wow, okay, that's huge. So the desire is clearly there.
And here's the paradox.
Yeah.
75% are not actively involved.
75% are not, so a massive gap. If they want to do it, what's actually stopping them? What gets in the way?
Yeah. The study really digs into that, breaks it down into like four main barriers. The first one is organizational culture and capacity.
Okay, what does that look like?
It means professionals consistently said they have no protected time for research. They're just swamped with clinical work, putting out fires.
Right, the day-to-day crises take over everything else.
Exactly. One hospice CEO even said, research feels like a nice to have, not core business. And often that comes down to funding pressures, intense pressures.
So it's like trying to add a new room onto the house when the roof's leaking. The urgent stuff always wins and research gets sidelined. Okay, so time is one thing. What else?
Well, let's say they did have the time. The second barrier is research knowledge, skills.
The know-how.
Precisely. Many staff, well, they just don't have the necessary skills beyond maybe some basic training they got way back. One nurse put it really well. She said, you do the research project within the course, and then you don't go near research again.
So it feels daunting.
Yeah, like a minefield of information was another phrase used. It really points to a need for, better training, accessible mentorship, that kind of thing.
Okay, so we need time, we need skills. What about the environment itself, the system?
You're hitting the third barrier. Infrastructure and collaborations. The system supporting palliative care research, it's often pretty weak.
How so?
Think about charitably funded hospices.
Right.
It's really hard for them to justify diverting donations away from, immediate patient care towards research, even if it helps long term.
I can see that dilemma.
And smaller places often feel really isolated. There's this feeling of we don't talk to each other across different hospitals or hospices or community teams. It's fragmented.
Right, a lack of connection. And the last barrier.
The last one is interesting. It's patient and public perceptions, but specifically as seen by the staff. Meaning the staff often feel maybe oversensitive. They worry about burdening patients who are already vulnerable by asking them to join a study.
That makes sense emotionally, but is that worry always justified?
Well, that's the counterpoint the study raises, and others too. Other research actually suggests patients often enjoy participating. They want to contribute to help improve things for others.
So the staff's perception might be a barrier in itself, even if patients are willing. Okay, here's what's really striking me. You said these barriers are stagnant.
Yes.
So this isn't exactly breaking news. People have known about these issues for a while.
That's the tough part. Yeah, many of these exact barriers.
Yeah.
Lack of time, funding issues, training gaps. They've been identified for a decade, maybe more. Progress has been really slow.
Wow. So what does that tell us? Why the inertia if we know the problems? Is it just deeper systemic issues? Maybe how we value this kind of care overall?
It certainly points that way. It suggests the challenges are deeply ingrained. But look, the study isn't all doom and gloom. It also highlights what works.
Okay, good. What are the facilitators?
Things like having dedicated research staff, obviously, active research groups within organizations, and crucially, collaboration. Things like alliances, umbrella groups that bring different organizations together.
So pooling resources and expertise.
Exactly. The big message is that organizations have to start seeing research not as an add-on, but as truly core business, something fundamental. When that happens, you foster a culture that, yes, advances knowledge, but also really improves patient care and, interestingly, staff satisfaction too.
Right. It becomes part of the mission.
Precisely. So the challenge now isn't really finding more barriers. We know them. It's about actually investing the time, the resources, the funding to tackle the ones we've known about for years.
Because applying this knowledge could make a real difference.
A significant difference to patient outcomes, quality of care, everything.
Okay, so wrapping this up, if the solutions seem pretty clear, collaboration, dedicated time, treating research is core,
Right.
and the professionals themselves are eager to do more, what's it really going to take? What's the key to finally getting that organizational culture and, crucially, the funding models to catch up so high-quality palliative care research becomes the norm, not the exception, for everyone?